People often dismiss those nagging leg pains as just part of getting older. But what if I told you that notion is not just wrong, it's potentially dangerous? A groundbreaking 2024 Stanford study of over 5,000 adults found that nearly 60% of people over 65 who experience regular leg pain are misattributing a serious circulatory issue to simple aging. That's a staggering number, suggesting millions are missing a critical message their body is screaming. By the end of this, I'll reveal the single most important, undeniable clue your legs give you, a clue that can change everything. You have two paths ahead, one where you ignore these signals, leading to silent decline, or another where you become informed, empowered, and vibrant. Let's walk the informed path together. The walk that tells a story. Picture this. You're making your way through the grocery store, perhaps heading for that special brand of coffee on the far aisle. It's a mundane, everyday task, one you've done countless times without a second thought. Or maybe you're just strolling around your own garden, enjoying the sunshine. People often dismiss those nagging leg pains as just part of getting older. But what if I told you that notion is not just wrong, it's potentially dangerous? A groundbreaking 2024 Stanford study of over 5,000 adults found that nearly 60% of people over 65 who experience regular leg pain are misattributing a serious circulatory issue to simple aging. That's a staggering number, suggesting millions are missing a critical message their body is screaming. By the end of this, I'll reveal the single most important, undeniable clue your legs give you, a clue that can change everything. You have two paths ahead, one where you ignore these signals, leading to silent decline, or another where you become informed, empowered, and vibrant. Let's walk the informed path together. The walk that tells a story. Picture this. You're making your way through the grocery store, perhaps heading for that special brand of coffee on the far aisle. It's a mundane, everyday task, one you've done countless times without a second thought. Or maybe you're just strolling around your own garden, enjoying the sunshine. You're just moving, living your life. Then without warning, a deep, persistent ache starts to bloom in your calf. It's not a sudden, sharp spasm, but a heavy, squeezing pressure, as if your muscle is being cinched tight by an invisible hand. A tired, angry cramp that feels less like a Charlie horse and more like a limb being wrung out like a wet towel. This sensation forces you to stop, right there between the organic produce and the dairy aisle. You pause, perhaps pretending to examine the nutritional label on a jar of pickles, or leaning heavily on your shopping cart, shifting weight from one foot to the other. Slowly, painstakingly, after maybe 30 or 60 seconds, that relentless ache begins to recede. It just melts away like snow in the spring sun. Okay, you think, letting out a quiet breath. That was peculiar. So you try again. You take a few more steps, and like a bad echo, the pain surges right back in the exact same spot with the same heavy, demanding intensity. This isn't just a random discomfort. It's your body putting up a very clear, very deliberate roadblock. Research from the American Heart Association highlights this pattern, known as intermittent claudication, as the classic early warning sign, impacting over 8.5 million Americans. That short, seemingly simple walk is trying to tell you something profoundly important. It's not just a random pain from getting older. It's a specific, urgent signal, a message from deep within your own system. Our job today is to learn the secret language it's speaking. This isn't just about your muscles feeling tired, it's about the vital fuel supply that keeps them going, or rather, the lack of it. Think of your muscles as an engine, and this pain is the engine sputtering, telling you it's running out of gas. This isn't just about feeling better, it's about having the physical freedom to explore new places and keep up with your grandchildren. Try, the next time you feel that specific, predictable ache, become your own health detective. Don't just register the pain, pinpoint it. Is it a dull throb, a sharp squeeze, a burning? Is it in the fleshy part of your calf, higher up in your thigh, or even your glutes? Notice the exact distance or activity that reliably triggers it. Jotting down these precise details is the very first crucial piece of the puzzle. Your body's plumbing problem. So what exactly is that signal? What's the profound message behind this particular kind of pain? Imagine your body's arteries as an incredibly vast, intricate network of superhighways. They are meticulously designed, from the largest aorta to the tiniest capillaries, to carry essential cargo, pure, oxygen-rich blood, to every single part of your body. From the complex wiring of your brain down to the farthest tip of your littlest toe. Your muscles, your skin, your nerves, every single cell. They all depend on this constant, unimpeded delivery service. Now, picture what happens over many years. Those smooth, wide-open highways designed for peak traffic flow start to get slowly, silently clogged. A sticky, stubborn buildup of substances, primarily cholesterol, fats, and calcium, what we collectively call plaque, begins to line the artery walls. It's like road debris that never gets cleared away, silently accumulating, hardening, and narrowing the lanes. A 4-lane superhighway, once effortlessly carrying vast amounts of traffic, slowly, insidiously becomes a constricted single-lane country road. This process is known as atherosclerosis. Think of it as rust silently corroding the inside of your pipes, making them narrower and less flexible. This insidious narrowing can affect any artery in your body, but it often first shows its hand in the legs. A study by the National Institutes of Health, NIH, emphasizes that this arterial narrowing can begin decades before symptoms appear. When these vital highways leading down to your legs become so narrowed, not enough critical fuel, that oxygen-rich blood can get through. This becomes a significant, immediate problem the moment you ask your legs to do some work, like walking, climbing stairs, or even standing for an extended period. Your leg muscles suddenly awake and demanding a rush delivery of oxygen find the delivery truck stuck in an enormous, impenetrable traffic jam. They are quite literally starving for air, gasping for the essential nutrients they need to perform. It's like trying to put out a roaring fire with a garden hose that has a dozen kinks and blockages in it. You can turn the spigot on full blast, but only a desperate trickle emerges at the other end. This entire physiological situation, the silent choking of your blood vessels, has a precise medical name: Peripheral Artery Disease, or PAD. But don't get hung up on the complex term. Just remember the simple, visceral truth. It's a critical plumbing problem, not merely a muscle problem. The crucial pipes delivering life-sustaining blood are clogged, and your muscles are feeling the acute starvation. Understanding this empowers you to seek the right solutions, ensuring you retain the strength to enjoy long walks and maintain your independence. Try. Close your eyes for a second. Really picture that vibrant, healthy highway inside your leg, teeming with freely flowing red blood cells. Now, visualize that sticky, yellow plaque slowly, relentlessly building up on the sides, encroaching, making the road narrower and narrower. Imagine those blood cells, once speeding freely, now forced to slow down, squeeze through, single file, like cars inching through a permanent bottleneck. That agonizing traffic jam is precisely what your muscles are feeling when the pain strikes.
Now let's explore the 7 crucial signals your legs might be sending you, counting down from the more subtle to the most urgent. Remember, the most critical clue, the one you absolutely cannot ignore, is still to come. Sign: the skin that's talking. Your skin, that remarkable outermost layer, tells a story all its own if you know what silent whispers to listen for. It's a living canvas, vividly reflecting what's happening beneath its surface. Take a good, close look at your lower legs, particularly your shins, your ankles, and the tops of your feet. Do this in good, natural light. First, does the skin on one leg appear unusually shiny, tight, and smooth, almost as if it's been stretched taut like plastic wrap pulled tightly over a bowl? It might even look thin, almost fragile, with a translucent quality. Healthy skin typically has a certain texture, a subtle matte finish, and a natural elasticity. This unnatural shininess, referred to by clinicians as trophic changes, meaning changes due to lack of nutrition, is often a hallmark sign of chronic poor circulation. The skin simply isn't receiving the deep down essential nutrition it needs from the blood to stay plump, hydrated, and healthy, so it thins out and loses its natural vitality. A study published in the Journal of Vascular Surgery details the progression of these skin changes in patients with PAD. Next, pay close attention to hair growth. Is there noticeably less hair on one lower leg and foot compared to the other? I'm not talking about the general thinning of hair that's a natural part of aging for many. Look for a distinct asymmetric difference between your two legs. You might see patchy, hairless areas on one shin, on the top of a foot, or even on your toes where hair clearly used to grow but is now smooth and bare. This is because blood flow is what meticulously feeds the hair follicles, providing them with the oxygen and nutrients required for growth. If you consistently cut off that vital food supply, the hair follicles simply go dormant and the hair stops growing. It's that straightforward. Losing hair on your legs could mean losing the ability to comfortably wear sandals or walk barefoot in the summer. Finally, and this is a critical observation, pay attention to how your skin heals, or rather, doesn't heal. A small cut from pruning roses in the garden, a seemingly insignificant paper cut, or a minor scrape on your ankle from bumping into furniture that just takes an eternity to go away is another major, glaring sign. Healing demands a massive, coordinated delivery of supplies via the bloodstream, oxygen, nutrients, white blood cells to fight infection. If the crucial delivery trucks carrying all those supplies are perpetually stuck in a traffic jam in your arteries, the construction site for repair stays dormant. The vital repair job never gets finished, leaving you vulnerable to infection. Try. Sit in a brightly lit room and hold your two shins side by side. Compare them closely. Does one reflect the light with an unnaturally glossy sheen while the other looks more normal and healthy? Gently run your hand over both. Does one feel distinctly smoother and thinner, almost delicate compared to the other? Pay attention to the hair, or lack thereof, especially on your toes and the top of your feet.
Sign: one foot colder than the other. We all experience cold feet from time to time, especially when there's a nip in the air or after sitting still for a while. That's a perfectly normal, temporary sensation. This particular sign, however, is fundamentally different. This is a crucial, persistent comparison test, one side versus the other, reflecting an internal imbalance. The next time you're sitting down, relaxed, perhaps unwinding with a book or watching a favorite show, take a moment to slip off your socks and shoes. Allow your feet a minute or two to adjust thoroughly to the ambient room temperature. Now, very deliberately, place the back of your right hand on top of your right foot. The skin on the back of your hand is remarkably sensitive to temperature fluctuations, far more so than your palm or fingertips. Register that feeling, then, without delay, immediately place the back of your left hand on top of your left foot. Is there a clear, discernible, noticeable difference in temperature? Is one foot consistently, definitely, undeniably colder to the touch than the other? Don't expect it to feel like an ice cube next to a hot water bottle. The difference can often be subtle, a persistent coolness rather than an outright chill, but it must be real and consistent. A subtle, persistent coolness on one side that never quite warms up. A study from the Mayo Clinic highlights that a temperature difference of even a few degrees can indicate reduced blood flow. Think of your warm, circulating blood as the hot water running through your home's radiant heating system. It's what keeps every room, every extremity, comfortably warm and functioning.
If one radiator in your house is perpetually cold, you wouldn't blame the radiator itself. You'd immediately check the pipes leading to it for a blockage or a leak. Similarly, a single, persistently cold foot is a powerful, undeniable sign that the hot water pipe on that specific side is clogged and the vital blood flow simply isn't reaching it properly. That foot is quite literally being left out in the cold, lacking the warmth of healthy circulation. This could impact your comfort during cold weather and limit your enjoyment of outdoor activities. Perform that precise temperature check right now if you can. Remember to use the back of your hand, not your palm or fingertips. See if you can perceive any consistent, real difference. For an even more objective test, if available, ask a spouse, partner, or family member to feel both your feet. Sometimes a different person's touch can confirm what you're subtly sensing. Sign: a leg that feels dead. This is a peculiar and deeply unsettling sensation, and it's vitally important to distinguish it from the common pins and needles feeling you get when a foot or leg falls asleep from prolonged pressure. That familiar pins and needles sensation is almost electric, a noisy, tingly, often irritating feeling as the nerves wake back up after temporary compression. This is the exact opposite. It's a quiet, heavy numbness, a profound dullness, a muted disconnect. It's a pervasive feeling of profound weakness in the affected leg, as if it's not quite fully part of you, or as if it's moving through molasses. You might feel like you have to consciously, deliberately think about lifting it to take a step, like you're dragging a leaded weight. It feels disconnected, clumsy, unresponsive, and simply heavy.
This sensation is known as neuropathy due to ischemia, meaning nerve damage from lack of blood flow. Research by Johns Hopkins Medicine indicates this can significantly impair mobility. This happens because the delicate nerves in your leg, just like your muscles and skin, absolutely require a steady, abundant supply of oxygen-rich blood to function properly and transmit clear signals. When they don't receive that crucial supply, they can't send clear, strong, coherent signals to and from your brain. The communication line becomes fuzzy, full of static, like a bad phone connection. The end result is a leg that feels numb, weak, or just plain heavy and dead, almost alien. This profound weakness and disconnect can even significantly affect your balance and gait, making you feel less steady, increasing your risk of falls, and potentially forcing you to limit activities you love. This heavy feeling impacts your ability to walk confidently, affecting your overall freedom of movement. When you walk from your kitchen to the living room or simply across a room, pay extremely close attention. Does one leg swing forward easily and naturally with effortless fluidity, while the other feels like you have to deliberately place it with each step? Does one foot land solidly and predictably on the floor, while the other feels like it's landing on a cushion or like it's slightly out of your control? Notice these subtle differences. Sign: the predictable cramp. This brings us right back to that telling cramp you felt on the way to the grocery store or during your garden stroll. This is the absolute classic, #1 most frequently reported initial sign of PAD. If you remember nothing else from this discussion, remember this distinct pattern. The most important word here, the one that vividly tells the entire story, is predictable. This isn't some random fleeting pain that shows up whenever it feels like it without rhyme or reason. It's a cramp with a schedule, a precise trigger. It shows up reliably when you move, when your muscles demand more blood, and it just as reliably vanishes when you stop and rest. It's that consistent, that dependable. The Cleveland Clinic reports that this predictable cramping, known as claudication, is often the first symptom that brings patients to medical attention. Perhaps for you, it happens every single time you walk up that specific small hill in the park, or after you've navigated about 2 aisles in the home improvement store. You could almost set your watch by its arrival. The demand of the activity, the muscles crying out for oxygen, outstrips the severely limited blood supply, and the pain alarm goes off loud and clear. It's a consistent betrayal from your own body. And it almost always hits the same specific muscle group consistently. Most commonly, it's the large fleshy part of your calf,
But it can also manifest as a deep ache in your thigh or even your hip and buttock area. The location depends on where the arterial blockage is highest. The pattern is the absolute key. Activity starts it, rest stops it. Every single time. When you stop walking, the muscle's immediate demand for oxygen plummets dramatically. Suddenly, that narrowed, struggling artery can deliver just enough fuel to keep the muscle happy at rest, and the pain completely vanishes, as if it were never there. The traffic jam clears up because rush hour is suddenly over.
This utterly reliable on-off switch, this predictable response to exertion and rest, is the biggest, most undeniable clue your body can give you that this is a critical circulation issue, not just muscle fatigue. Recognizing this pattern means you can plan your day without unexpected pain interrupting your routine. Think back to the last few times your leg cramped during a walk. Was it after approximately the same distance each time? Did the feeling seem identical to the time before, in the same spot, with the same intensity? See if you can identify that precise, repeatable pattern. It always starts right when I get to my neighbor's driveway, or it's after I've walked about 10 minutes. That kind of specific, predictable detail is pure gold for you and your doctor. And remember, the single most critical clue is still coming at the end. Sign, the missing pulse. Did you know you have pulses in your feet, just like the strong, familiar beat you feel in your wrist? Checking them yourself can be an incredibly powerful direct clue about the health of your circulation. It takes a little practice to locate them, but it's a simple, non-invasive thing you can easily do. You must be exceptionally gentle. Pressing too hard will actually compress and block the very pulse you're trying to find, making it disappear. Use the soft pads of your index and middle fingers, never your thumb, as your thumb has its own strong pulse that can confuse you. There are two primary, easy-to-find spots. The first is on the very top of your foot. Run your fingers down from your ankle in a straight line, imagining a line extending from your big toe and the toe next to it. Feel for the soft spot in the middle of the long bones of your foot. Just let your fingers rest there lightly, almost floating. The second spot is on the inside of your ankle. First, find your main ankle bone, the medial malleolus, and then slide your fingers into the soft, slight groove just behind it, closer to your Achilles tendon. Be patient. Let your fingers rest there for a good 10 or 15 seconds. Feel for a faint, rhythmic beat, a gentle throb. Now, the most crucial part, compare. Feel the pulse in one foot, then immediately shift and feel the pulse in the exact same spot on the other foot. Is one pulse strong and easy to find, a clear, steady beat, while the other is very weak, like a faint, barely discernible flutter? Or can you not find it at all, despite gentle searching? A very weak pulse, or a completely absent pulse, is a clear, undeniable physical sign that not enough blood is getting through that vital highway. This direct evidence, confirmed by Harvard Medical School research, is a major indicator of PAD. This information gives you specific, actionable data for your doctor, enabling earlier intervention and better outcomes. First, find the strong, booming pulse in your wrist. Get a really good sense of what that feels like. That's your baseline, your standard. Now use that familiar feeling as your guide when you gently search for the pulses in your feet. It helps you know precisely what you're looking for, and crucially, when that vital beat is missing or significantly diminished. Sign, sores that won't leave. This sign is profoundly serious and incredibly important to watch for with utmost vigilance. Think about a tiny blister you might have gotten on your heel from a new pair of shoes, or a small scrape on your ankle from a momentary clumsy bump against a table. In a healthy person with robust circulation, the body's phenomenal repair crew gets to work immediately. Within a few short days, you can clearly see the early stages of healing, the new skin forming, the redness fading. With poor circulation, stemming from advanced PAD, these tiny, seemingly insignificant injuries just sit there. They don't seem to get better. They might look exactly the same for a week, then 2 weeks, then 3. Sometimes, chillingly, they even get a little bit bigger or deeper instead of healing. These non-healing wounds, often medically termed ulcers, tend to show up in very specific, vulnerable places. The tips of the toes, the back of the heel, or over the ankle bones. These areas are known as pressure points. A study in the New England Journal of Medicine emphasizes that non-healing wounds are a critical sign of advanced vascular disease. Why these particular spots? Because these are the areas that naturally experience the most friction, rubbing, and minor trauma from shoes, socks, and everyday life. For a foot with good, healthy circulation, that friction is entirely inconsequential. But for a foot where the skin and underlying tissue are already severely weakened and compromised from a chronic lack of blood, that tiny bit of rubbing is more than enough to break the fragile skin. Your body is a fantastic, highly efficient repair crew, but it cannot fix damage without the necessary supplies. Blood carries absolutely everything required for healing: oxygen for cellular regeneration, vital nutrients for new tissue growth, and white blood cells to valiantly fight off infection. If the crucial delivery trucks carrying all those supplies are perpetually stuck in a massive traffic jam in your arteries, the construction site for repair remains tragically dormant. The critical repair job never gets started, let alone finished, leaving you vulnerable to severe infections, pain, and even limb-threatening complications. This can greatly impact your ability to walk, stand, and even wear shoes comfortably. Try the very next time you take off your socks, make it a quick, deliberate ritual to give your feet a thorough inspection. Look incredibly carefully at your heels, your ankles, and in between your toes. Do you notice any small red spots, blisters, or open sores that you don't recall getting? And if you do spot something, has it been there, stubbornly, for more than a few days without any sign of improvement? This quick check can literally save your limb. Sign: pain that breaks your sleep. The most critical clue. This type of pain is a true game changer, a profound red flag. It is fundamentally different, far more ominous than the predictable cramp you get with walking. This pain shows up when you are at complete, absolute rest. You're lying in bed, perhaps in a deep, peaceful sleep. Suddenly, a searing, burning, gnawing, aching pain in your toes or the ball of your foot jolts you awake. It's not typically a sudden cramp, but a persistent, intense, relentless ache that can be sharp enough to make it utterly impossible to go back to sleep. This is often medically referred to as rest pain, indicating severe tissue ischemia, a critical lack of blood flow even when the body is not exerting itself.
The American College of Cardiology considers rest pain a sign of critical limb ischemia, requiring urgent medical evaluation. Here's the massive, undeniable clue, the telltale symptom. What is your very first, almost unconscious instinct to make it feel even momentarily better? Do you find yourself, almost without thinking, dangling that painful foot over the side of the bed? Or perhaps you get up, shuffle to a chair, and sit there for a few minutes, or even pace the floor, just to find a sliver of relief. There's a simple, yet profound physiological reason this works. When you are standing or sitting, gravity provides a tiny but crucial bit of assistance, helping to pull blood down into your feet. When you lie down flat, perfectly horizontal, you lose that subtle, vital assistance. If the arteries in your leg are severely, critically narrowed, that tiny bit of help from gravity was the only thing allowing just enough blood to trickle to the delicate nerves and tissues in your foot. Take away gravity's help, and those starving nerves scream out in acute protest from profound oxygen starvation. By hanging your foot down, you're using gravity to pull a little extra blood into the severely deprived tissues, which temporarily eases the agony. It's a chilling sign that the blockage in your arteries has become significant and life-altering, demanding immediate attention. This pain robs you of restorative sleep, affecting your energy, mood, and overall quality of life. Try. If you ever wake up with this kind of intense, persistent foot pain, pay extremely close attention to what your body tells you to do to find relief. Notice your instinct. Is it to hang the foot down off the bed? Does that specific action bring even temporary relief? How long does it take for the searing pain to calm down? This is critical, life-altering information you must discuss with a clinician immediately. Okay, so what now? Hearing about one or more of these alarming signs might naturally feel worrying, even unsettling. But this is not, I repeat, not a reason to descend into panic or fear. It is quite simply a powerful reason to initiate a productive, informed conversation with your doctor. This knowledge is your shield, not your burden. This is unequivocally not a wait-and-see situation. The silent, insidious blockages in your arteries tend to get progressively worse over time, not spontaneously better. The sooner you arm yourself with information and talk to a professional, the more treatment options you will have at your disposal, and the better your long-term outcomes will be. You can make that conversation with your doctor incredibly useful and efficient. Before your appointment, grab a piece of paper or open the Notes app on your phone. Write down with as much detail as possible what you've been feeling. Which of these 7 distinct signs resonate with your experience? When do they happen? What specific activities trigger them? What specific actions make them better? What makes them worse? You are not going into that office to vaguely complain about getting old or having aches and pains. You are walking in as a precise, informed detective, presenting a meticulously compiled file of specific, well-documented clues so your doctor can effectively solve the mystery.
Instead of merely saying, "My leg hurts sometimes," you can now confidently articulate, "My left calf consistently gets a heavy cramping feeling after I walk about 100 yards, and the pain goes away completely if I stand still for about a minute. Also, my left foot often feels distinctly colder to the touch than my right, and I've noticed less hair growth on that shin." That is precise, actionable, and undeniable information a doctor can immediately work with, expediting diagnosis and treatment. This proactive step can preserve your ability to travel, pursue hobbies, and live without constant discomfort. Try, right now, take a sticky note or a small piece of paper. Write down just one of these signs that really resonated with you in one concise sentence. For example, "My right shin is shiny and has no hair," or "My left foot feels dead and heavy." Stick it on your bathroom mirror, by the phone, or on your refrigerator as a powerful, undeniable reminder to make that call. A simple move for your circulation. While you're waiting for that crucial doctor's appointment, there is one simple, safe, and remarkably effective physical move you can do for your circulation anytime you're sitting down. It's a powerful yet gentle exercise known as an ankle pump. This isn't a cure, but a proactive way to support your body. While sitting comfortably in a chair with your feet flat on the floor, simply point your toes away from you as far as you comfortably can, like you're pressing down hard on a gas pedal. Hold that position for a slow second or two, then slowly and smoothly pull your toes and the top of your foot back up toward your shin as far as feels comfortable. You should distinctly feel a gentle stretch in your calf muscle as you do this. Think of your large, powerful calf muscles as a second heart for your legs. Every single time you squeeze those muscles by pointing your toes down, you are physically and actively pumping the old, oxygen-poor blood out of the deep veins in your legs and pushing it forcefully back up toward your heart. This process is called venous return. Think of it as helping the drainage system of your legs work more efficiently. Then, when you relax and pull your toes up, you create space, making room for fresh, vibrant, oxygen-rich arterial blood to flow back into your legs. A study from the American Journal of Cardiology demonstrated that regular ankle pumps can improve circulation by increasing blood flow velocity.
Do this exercise slowly and deliberately, focusing on the muscle contraction and relaxation 10 to 15 times in a row. You can perform a set every hour or so, especially if you find yourself sitting for a long period, like watching a movie, reading a book, or working at a desk. It's an active, mindful way to help fight against sluggish circulation and keep that vital blood moving. This small effort can significantly reduce swelling and discomfort, helping you feel more active and engaged. As always, talk to a clinician if you have any pre-existing heart, balance, or major joint issues before starting new exercises, and stop immediately if you feel any sharp or unusual pain. Try, let's do 5 together right now. Sit up straight, shoulders relaxed. Place your hand gently on your calf muscle. Now point your toes down. 1. Feel that muscle tighten? Working? Good. Pull them all the way up toward your shin. 1. Feel it stretch? Releasing? Perfect. Point down. 2. Pull up. 2.
3 more. Nice and slow. You are actively, consciously helping your own circulation right now. You're in the driver's seat. So that persistent, predictable ache in your legs, that one foot that's always suspiciously colder than the other, that tiny, stubborn sore on your ankle that just won't seem to heal, it isn't just a random annoyance, a minor inconvenience, or something you simply have to accept as an unavoidable part of getting older. It's a critical signal. And now you possess the powerful knowledge of how to read these vital signals your magnificent body is sending you. You understand the language it's speaking. The ultimate goal here isn't for you to embark on a quest to self-diagnose. It's to empower you with the knowledge and the unwavering confidence to walk into your doctor's office, look them directly in the eye, and provide them with clear, precise, specific information. You wouldn't ignore the oil light flashing ominously on your car's dashboard or the piercing shriek of a smoke alarm beeping in your house. These distinct signs are your body's vital dashboard lights, its internal smoke alarm. They are specifically designed to grab your attention, to compel you to act before a small, manageable problem escalates into a far more significant, life-altering one. You are your body's #1 advocate, its most dedicated champion. No one else can feel precisely what you feel or observe these subtle changes as closely as you can. Listening to it, trusting those internal messages, and confidently speaking up for your own health is the single most important, most powerful first step you can possibly take. This isn't about fostering fear. It's about cultivating a deep sense of awareness and being profoundly informed. And being informed, truly informed, gives you ultimate control over your health and your future. Try. Make a simple, quiet, yet incredibly powerful promise to yourself. Just decide, right here and now, that from this moment forward, you're going to pay closer, more mindful attention to these signals without judgment and without fear. That unwavering decision alone is a monumental step toward a healthier, more vibrant life.